Hi guys, so in this short video, I'm going to try and cover two of the most requested topics I've had so far. The first one being, what is the best way for a final year or a UG to approach NEET, or how can a UG study for NEET? And the second one being, how a UG or a final year, that is be it second, third or fourth, or even first years, can use Marrow in the most efficient manner, or the best way for a UG or an undergraduate to use Marrow. So before I start, I've broken down this discussion into three headings. Firstly, the aim of an undergraduate preparation. Secondly, the core principles that an undergraduate should follow. And lastly, on how you can make high yield material. And I'll also talk about how Marrow should be used efficiently at all these stages. So firstly, let's talk about the aim, or what I feel should be the aim of an undergraduate preparing for NEET. So I feel there are just two aims that they should keep in mind. The first aim is to learn and understand basic concepts well, and the second aim is to create material for your internship or post-internship preparation. So at the end of the day, for these exams, it is the internship and post-internship preparation that matters the most, not the UG preparation. So your aim at the UG level should just be to understand as many concepts as you can, to understand the basics really well so that you don't have to keep going back to it, and also to create some notes, flashcards or some material that you can use for a quick revision during your internship or post-internship period. Again, because internship you'll be busy, so you want something that you can quickly go through. So yeah, that's the basic aim you should have for your preparation. The how you approach it can vary from person to person, but I feel this is what you should keep in mind. Now let's talk about few of the core principles that a final year or second year or third year or any undergraduate should follow when they are looking at a competitive exam. So before I talk about these principles per se, let me tell you, I didn't follow all of these. But now in retrospect, I wish I had followed all of these, and these are what I feel can really help you improve your score and rank. Or these are things I wish I did. So firstly, the first principle is to study well for your university exams. At the end of the day, you have to study for these exams. They are still your number one priority, and passing them is still your number one priority, because to give NEET, you have to clear your university exams. And also remember, the subject is the same. So studying the subject well for your university exams will for sure help you in your competitive exams. Also, there is a belief going around that studying for university exams and subjective exams has no role in NEET. I feel that's really wrong. If you do study these subjects really well for the university exams, it will definitely help you in NEET. Secondly, take clinics seriously. So clinics is the place where you actually see things, you see diseases, you see syndromes, you see things with your own eyes, and that helps it retain for longer. That helps you remember these things for longer. So take clinics seriously. Seeing something in the hospital will help you remember it better than just reading about it or watching videos on it even. The third thing is to focus on building concepts and strengthening them. Again, something I said earlier also, building concepts and making your basics strong at this level itself will definitely help you in your future. And you can just focus, or you can spend internship just looking at the memory based things if your concepts are strong from the start. Because remember, concepts stick on, right? Concepts always stick on with you. So once you understand something, once you grasp a concept, it usually stays in your long-term memory. So you don't need to keep going back to it. And lastly, this is something I didn't even approach or didn't even try. Practice solving a few MCQs once in a while. So like I said in my previous video, internship is all about MCQ solving. So your internship and post-internship preparation is all about MCQ solving and practicing MCQs. But at the UG level, your focus is at building concepts and creating material. And also on the side, spend some time solving MCQs just to accustom yourself, or just to get used to solving MCQs and used to the approach of solving MCQs. So this should be the last priority. So when you suppose you read some chapter, for example, antepartum hemorrhage, that day evening, go back, read it again, revise it, create your own notes from that topic, and then solve a few MCQs of that topic, because it will help you firstly understand how to apply that concept, and secondly gives you a feel of solving MCQs. So these are the four principles I feel that any UG should have. So now we'll talk about how we can use Marrow efficiently to apply these four principles. So firstly, can we use Marrow to study for the university exams? Definitely yes. So I actually watched Rohan Khandelwal sir's videos and Sakshi ma'am's videos for my final year. That's when I took Marrow, and it definitely helped me do really well, or well at least in my university exams. So yeah, the notes that you get from these videos and from Marrow are fantastic, and it's really helpful even with your university exam. So yes, definitely reading textbooks is good. I did read a few textbooks too, but these notes were the last minute revision for me, and they helped me do well in my exams. So yes, Marrow content is good for your university exams too. Secondly, how will Marrow help in clinics? Not too much, but solving MCQs helps you in building that application based thinking, Next, focus on building concepts and strengthening them. So this is where you can really use Marrow to its best, whether it is the MCQs, whether it's the pearls, or whether it's the videos. Again, watching those videos will definitely help you focus on concept building and will help you build concepts a lot better, because there is someone of that caliber explaining things to you and breaking complex topics down to basic things. Lastly, practice solving MCQs. Again, like I said in all my videos, my only source for MCQs was Marrow. So again, I think if you use these 4 principles, you can apply these 4 principles into the Marrow app, and that will ensure that you use the app to the best of its capability. So again, I think I've addressed that question. Lastly, how can you create material for your preparation? So don't make too elaborate notes. Focus on what's high yield. Look at what's more asked. Look at previous year papers. Look at things like that, and see which topic is more frequently quizzed, and make small 1 page or 2 page notes on that topic. Try to cover everything significant in that topic in just 1 page or half a page, and this is something you will use to revise in your internship. So don't make elaborate notes, don't make notes which are very theory like. It should just have the high yield points. For example, keloid is a type of defective scar formation. There's hypertrophic scar. About the boundaries, type 3 collagen is seen. This is a frequently asked MCQ. So things like that. So find out what's high yield, identify the high yield points, and create one compact master page notes. So create your own notes and make sure it's concise. And these notes are what you will be using to revise in your internship when you're short on time. So I think this is, according to me, this is how a final year or a UG should approach, or the best approach according to me.